A baby suffering from a rare form of eye cancer is brought to Israel to undergo special treatment. The therapy could save little Victoria's eye and her life. Our correspondent brings us the details.
Retinoblastoma is a very aggressive cancer, and a baby develops the eye affliction early on in his or her life. The vigilance of baby Victoria's mother brought her to diagnose and receive treatments for her 17-month-old baby in her native homeland of Belarus. The common signs of the disease's progression is that an infant's eye becomes white or yellow, or the child develops sideways vision.
In February, I saw a light inside her eye, but I didn't pay attention to it, and I didn't think it was anything unusual. But in April this year, we decided to see an eye doctor. We received a frightening diagnosis: retinoblastoma. I felt as if the earth was slipping from under my feet. I was feeling terribly depressed.
In the past, children died from the disease because the cells grew in the eye and spread to the infant's brain.
After we were given this terrible diagnosis in Belarus, the doctors summoned us to have an operation and remove our baby's eye on June 1st, 2011. We began to look for medicine and clinics through the internet in Israel and Germany. Within 3 days, we received an official response from Israel and a booking for treating our child at Sheba Medical Center, Tel HaShomer.
The Pancros and Victoria landed in Israel in late May. Dr. Dai was assigned to the case. The purpose of the therapy was to save the child's life, her eye, and her vision.
In the case of Victoria, even though it is a difficult and deadly cancer, we're talking about involvement of only one eye, and therefore she's particularly suited for this special treatment, in which we will apply chemotherapy only to the infected eye.
The treatments that Victoria receives at the Sheba Medical Center have just begun and are not easy for the toddler.
Of course she has pain. She cries at night. It looks like she has nightmares, but she is going through it well now.
In recent years, there has been a revolution in the field of disease management. In the past, chemotherapy was done on all of the eye, hurting healthy eye tissue as well. Today, the therapy is targeted.
In practice, the innovative treatment is performed by a specialist, Dr. Matthew Bacon at Tel HaShomer. He inserts a very small and gentle tube into the artery that directly reaches the eye, and inside that artery we inject the chemotherapy.
Dr. Dai says that the eye examination policy for infants in the Western world is to test babies at the age of 1 year, 3 years, and 6 years. She adds that parents must be aware of all ongoing changes with their children's eyes. If there is any suspicion, the child should be brought in for additional checkups. NTD News, Israel.